When I first decided that I was going to retire, I was, I guess, naive about the whole Social Security and Medicare dilemma that we all face. I thought it was just going to be a simple act of going online, getting signed up, and collecting a check. Thought I was going to go online and pick my Medicare insurance and have it all laid out for me. Man, what an awakening I had once I began doing my research and trying to decide what I needed to do. So, in today's episode, I'll try to untangle some of those ins and outs and the complexities of Social Security and Medicare. So, stay with me, and I'll be right back.
Well, hello and welcome. Thank you so much for stopping by. Really means a lot to have you on board. You're at the Five Forks. I'm your host. My name is Barry. Here at the Five Forks, we discuss topics of interest for the newly retired, those about to retire, and some topics for those that might have been retired for some time. I hope that these things that we discuss will be informative and entertaining, and I hope you check in each week to see what's new. So come along for the ride. Let's get started. Here's today's episode.
I think it's safe to say that most of us, at some point in our retired lives, make the decision to collect Social Security benefits. That's a program we've paid into for our entire working career, so hopefully we'll get to reclaim some of the money that's been withheld from our checks for our whole life. But it's important to understand the issues surrounding Social Security. For instance, the age that you can claim your full benefits varies depending on when you were born. Now, if you were born between 1943 and 1954, your full retirement age is 66, and 67 for those born 1960 or later. But there's additional criteria. If you were born in 1942 or years between 1954 and 1960. For instance, I was born in 57, so my full retirement age, 66 and 6 months. Why it's got to be so confusing, I don't know. It should just make it straight up. At an age, you get to start drawing, but it's just not that way. Now, you don't have to wait until your full retirement age to begin drawing your Social Security benefits. You could start at 62. But if you do so, you're going to be giving up a portion of your monthly payment that you would have gotten if you waited until your full retirement age. And if you delay taking your benefits after you reach your full retirement age, your benefits increase by 8% per year for each year that you delay up to age 70. You've got to be the one to judge and make that decision based on your financial situation and what you think your life expectancy might be. It may or may not make sense to delay, but you could do the math. You could sit down with a calculator and figure, okay, I'm going to start drawing at 62. So between 62 and let's say if you're going to live to 80, you've got 18 years that you could draw. Weigh that against, when you think that what your life expectancy is based on your health condition, so on and so forth. And if you have difficulty making a decision on when to draw, it's best that you seek out the advice of a qualified financial planner. I'm not one, so I can't advise you on that. I do suggest, however, that you go onto the Social Security Administration website and do some reading. Take advantage of the estimation tools that they have available there. The site is ssa.gov. And then once you establish an account, create your username and password, answer some questions, and of course you're going to need your Social Security number. You'll be able to then see and review your work salary history. And that's important because Social Security is going to use your highest 35 years of earnings, adjusted for inflation, to index the average monthly earnings. And that in turn is used to figure out how much you're going to draw each month. So you need to go on, check that out, make sure everything looks correct, and contact Social Security if you have any questions. You can then go through the different scenarios. They have calculators that let you estimate how much you'll draw at different dates or different ages along the way. And it'll help you understand the effects of taking early retirement or delay it. And then when it's time that you want to start your benefit application, you could do that right there on that website. Another complexity of Social Security is that, some of us are going to continue to work, whether it's part-time or full-time, after we've made the decision to begin drawing our check. However, there's some limitations to how much you can make while working, and there's some penalties that you might face if you go over those limits. It's called the Social Security wage limit. And in 2023, that amount is $21,240 that you can make up to and still draw your Social Security check. But if you go over that, SSA will take $1 for every $2 you've earned over the limit. Now, when you reach full retirement age, they'll recalculate what your monthly benefit will be, and you'll get that back. It won't be taken away from you for life, but still. Now, during the year that you reach full retirement age, that $21,000 increases to $56,520. And then once you have reached your full retirement age, then you can earn any amount. It's not restricted. Now, every state's going to have different tax laws, and you're going to have to do your research there and plan for the taxes you'll have to pay at the end of the year if your state is one of those that taxes Social Security. Federal Social Security tax limits do apply if your gross income, non-taxable interest, and half of your Social Security payments exceed $25,000. $32,000 for couples. Part of your Social Security benefit could be taxed, and it gets even worse the more money you make. So everyone has different circumstances, and you need to look into this and plan for all aspects of Social Security. Now, it's all laid out and explained pretty well on the website, and I feel that ssa.gov is a great resource. But you can always call your local Social Security office and make an appointment and go see someone face to face and ask them all these questions. Make sure you're comfortable with what's going on. And I've always found that the staff are great to work with anytime that I've called. So it's something that you might want to take a look at. And again, I can only say that you need to contact your financial advisor and have him to look over everything, or her look over everything. Then, once you're comfortable with your Social Security investigation, it's time to tackle Medicare. The Medicare is a federal government health insurance program for individuals that are age 65 and older, as well as certain younger individuals with disabilities. What I'm going to discuss is only the portion for those that are 65 and older. And it consists of several different parts. They cover different aspects of your health care, and it can be confusing. My best advice here is to find yourself a licensed Medicare insurance agent that can go through all your options with you to determine the plan or plans that are right for you. I'm not the person that can make a recommendation to you, but I'll try to cover what you need to consider and maybe help you develop some questions regarding each part of Medicare when you talk to whoever you decide to get in touch with. Now, sometimes Medicare is referred to as Original Medicare, and that's Part A and Part B. And it's important to note that when you first become eligible, you need to sign up at that point, or you could incur some penalties that will continue for the entire time you're on Medicare. You can avoid the penalties if you're still working and your employer provides your health care plan. But again, you need to talk with an advisor or call the folks at Medicare.gov and be sure you're covered in this case. Now, Medicare Part A is basically hospital insurance. It covers your inpatient hospital stays, including a semi-private room, your meals, general nursing, and all your other services and supplies while you are physically in a hospital bed. It'll also cover eligible stays in a skilled nursing facility for individuals who meet the requirements, and this could be for people that need short-term rehabilitation service after they've been into the hospital for a while. Part A will cover hospice for individuals with terminal illness, and this includes medical and support services provided to manage your pain and provide comfort during the final stages of life. Part A will cover medically necessary home health services, such as part-time skilled nursing care, physical therapy, occupational therapy, durable medical equipment, and this can enable individuals to receive necessary care in the comfort of their own home. Preventative services. Part A does cover certain preventative services, such as screenings for your cardiovascular disease, screenings for various types of cancer, diabetes, and more. These services are aimed at early detection and prevention of serious health conditions. Now, it's important to note that while Part A covers certain costs, there may still be some deductibles, co-insurance, and co-payments associated with these services, so it's advisable to review your specific situation and understand the coverage details to better plan for your potential healthcare expenses. Most people don't pay any premium for Part A. That is, if you or your spouse has paid Medicare taxes while working, you should not have to pay any premium for Medicare Part A. Now, Medicare Part B is your medical insurance. And while most people don't pay for Part A, everyone pays for Part B. The cost in 2023 was $167 a month, roughly, and then in 2024, that will increase to $175. That's deducted straight out of your Social Security check before you ever receive it each month. So Part B will cover visits to your primary care doctors, including general practitioners, your family physician, internist, and these visits typically involve routine checkups, screenings, preventative services, and management of ongoing conditions. Part B will also cover visits to medical specialists, such as your cardiologist, dermatologist, oncologist, and other specialized healthcare providers. And each one of these visits, might involve some diagnosis, some treatment, management of some specific medical conditions. Part B is going to cover a variety of diagnostic tests, like X-rays, MRIs, CT scans, laboratory tests, blood tests, all these things that help a doctor diagnose and monitor medical conditions. You can even have coverage for some outpatient procedures that are performed in the hospital or some other healthcare facility. Examples would be minor surgeries, colonoscopies, cataract removal, joint injections, and certain rehabilitation therapies. So, Part B will also cover your ambulance transportation to a hospital or a skilled nursing facility if it's deemed medically necessary. I don't know how they deem that. I mean, most of the time, if you call for an ambulance, you're in need. It is necessary. So, not sure what they mean by that. Part B will cover some mental health services, psychiatrists, psychologists, clinical social workers, and other mental health professionals. Part B does emphasize preventative care and covers a wide range of those preventative services, such as regular wellness exams, vaccinations, screenings, various conditions like cancer, diabetes, cardiovascular disease, and counseling for smoking cessation and obesity. Now, remember, while most doctor visits and outpatient services are covered by Medicare Part B, it's important to check with your healthcare provider and review the specifics of your coverage and understand any limitations or requirements. Now, what's not covered by Part A and Part B? A lot of things you might have been accustomed to if your employer provided your healthcare policies, and they won't be included in Part A and Part B. And these include stuff like your vision insurance for exams and prescription glasses, dentures, routine physicals. Most dental care is not covered. Hearing aids, long-term health care such as permanent assisted living or nursing homes. So most of us are going to need to find some form of supplemental insurance coverage. And so let's take a look at some of those and see what they cover. Medicare Part D is your prescription drug coverage program. And now this is offered by private insurance companies, but they've been approved by Medicare. And it helps the beneficiaries cover the cost of prescription drugs. But there's some key points. You can enroll in Part D when you first become eligible for Medicare during what they call the initial enrollment period. And if you don't enroll during this period and you don't have other prescription drug coverage like from your employer, you may have to pay a late enrollment penalty when you do sign up. So it's important that you pay attention to what you're needing at the time that you have to sign up for all this. Make sure you're getting everything covered. Now, Part D plans offer a list of prescription drugs, and they call these formulary. And each plan has its own formulary. So when you start reviewing the prescription drug plans for Part D, you need to make sure that your drugs are covered. And typically these plans have different tiers or levels of drugs, which after each tier, there's a different cost sharing requirement. Most Part D plans have various costs, including a monthly premium, an annual deductible, up to a certain limit. You might have co-payments, co-insurance. You might have a co-insurance for each prescription. And premium costs will vary. So it's important that you take a look at all of the plans and find the one that meets your needs. There's many plans, Part D plans available, so you compare each one of them and see what your specific needs are. And you can go on the Medicare website, and they've got a plan finder tool, and you can actually put in your drugs to see if they're covered. And remember, Part D is optional, but if you take prescription medications, it's really important to consider enrolling in a Part D plan. Now, Medicare Part C is also known as a Medicare Advantage plan, and it's an alternative way to receive your Medicare benefits. Sometimes Part C or Medicare Advantage plans they're not looked on favorably by some people because a lot of the plans have been in the past not quite up to par. That's changing quite a bit, and it's all regulated. It's all covered and approved by Medicare. So there's a lot more standardization now than there has been in the past. But basically, Medicare Advantage is an alternative way to receive your Medicare benefits, and it combines the coverage of Parts A and Parts B into a single plan. It's offered by a private insurance company, approved by Medicare, and under certain circumstances, the Advantage plans could be the way to go. But when you're deciding, you just got to take a look at it and get the right choice for you. But there's several factors you need to consider. You need to evaluate what your needs are, determine which services and benefits are important to you. Medicare Advantage plans may offer additional coverage beyond original Medicare, such as they could cover prescription drugs. You wouldn't have to get a Part D plan. And, if you take a lot of medications, and some of them can be quite expensive, this might be something you want to consider. Most of them will offer some type of vision care, some type of dental care, and a lot of them will even cover hearing aids. A lot of Advantage plans have wellness programs. Some of them have access to what's called silver sneakers, and silver sneakers is a program that promotes healthy living, and you can even get a gym membership paid for if you're in an area where you have somebody close by that's participating. And there's a network of providers. Now, a lot of times Medicare Advantage plans have a network that's called an HMO. And if you choose an HMO, you're going to have certain restrictions as to where you can go and who you can see. Other programs have PPO plans, and you can check in with each one of them and see if your doctor is participating in that network. And so then that gives you a lot more flexibility. You can continue to see the doctors or the specialists that you have always been accustomed to visiting. You've got to review the cost. This includes monthly premiums, deductibles and co-payments and co-insurance, and compare these costs to what you would pay under original Medicare. And consider your budget and how the plan's costs will fit into your budget in line with your financial situation. It's going to be different for everyone. Now, some of these plans offer very small to no monthly premium. However, you're probably going to pay a lot more for your out-of-pocket expenses. In other words, you're going to pay deductibles and co-insurance and specialist visits up to a certain amount. And that amount can oftentimes be a lot higher than you'll get in original Medicare. But most of them are going to, like I said before, they're going to have prescription drug coverage. You can put your list of drugs in and make sure they're going to be covered. Now, flexibility in travel could be a problem because Medicare Advantage plans a lot of times have restrictions on seeing out-of-network providers. So that can limit your flexibility. If you frequently travel or live part of the year outside of the plan's service area, you need to consider whether that plan fits your lifestyle and your healthcare needs in different locations. You also need to look into the plan ratings and reviews and research the quality ratings and customer reviews of each Medicare Advantage plan. Medicare provides star ratings, 1, 2, 3, 4, 5 star. And so a lot of plans based on factors like member satisfaction, customer service, and health outcomes will have higher ratings. So consider the ratings, and we'll give you an idea of the plan's performance and what the members' experience has been. And, it's essential that you carefully compare the options available to you and consider how well Medicare Advantage aligns with your unique needs and preferences and your budget. And you may find it helpful, again, to make sure that you're talking to a licensed insurance agent. Now, there are other supplement plans that will augment your original Medicare, your Part A and Part B. These are often called Medigap plans. And they're a type of health insurance policy that helps cover the gaps in original Medicare and Part B, your medical insurance. But it doesn't cover all medical costs. And Medicare supplement insurance plans are sold by private insurance companies, and they can help you pay for out-of-pocket expenses, such as your deductibles, co-payments, and co-insurance. Now, all of these plans are standardized. They're labeled with the letters A through N, excluding the letters E, H, I, and J. I don't know why that is. And also Part A and Part B, so I don't understand what the lettering system is about, but there's different coverage for each lettered system. So each one is offering different levels of coverage, and it's important to note that supplemental Medicare insurance, a Plan N or a Plan G or whatever it is, cannot be used alongside a Medicare Advantage plan. So each lettered supplement plan is going to be a little bit different. And there's so much to cover that I won't do that here, but just know this is available, and it's something that you should look into in your total research of what kind of medical insurance you're going to select. The plan premiums on some of these plans can be quite high, but you got to decide, which one fits your budget and the level of care that you require. I can't say it enough. There's just a lot to unpack when you're reviewing the different Medicare coverages. Get yourself some help. Seek the advice of someone licensed in the field. Talk to your primary health care provider. Get, assistance from them. Anything that they might be able to provide. I just don't want you to be left with an expensive surprise down the road. You got to start early, long before you're ready, so that you have plenty of time to make the right decision. Look into all this stuff and put this part of retirement planning behind you so you can enjoy your days and have some peace of mind. I don't know if I did you any good or not. I hope you got something out of this episode, and I hope I might have pointed you in a direction that you can use to take care of yourself, and hopefully you'll have at least some of the things to research and questions to develop, and I hope that you're able to select the program that's right for you. I'll probably come back to this in a little bit of time after I have gone through my program. I did pick a Medicare Advantage plan, and there's many reasons for that. But once I have had to use it a few times and I know what the response is, I'll probably come back and review that. So for today, I'm gonna close it right there. I hope I've given you plenty to think about, and I hope that you'll be able to find the right program for you. So until next time, just hope you guys take care of yourself, and I will talk at you soon.
Well, that does it for today. Thanks again for stopping by, and I hope you enjoyed this episode. Please leave me a comment. Let me know how I'm doing. Like, subscribe, and follow so you'll know when a new episode is available. And share this with your friends. And if you like the content, you can always buy me a coffee. That link's www.buymeacoffee.com/@the5. Once again, you've been listening at the Five Forks. And until next time, when faced with a fork in the road, take it.